Do some hands-on stuff here. So, what was your name again?
Rita.
Rita, pleasure to meet you. Dr. Moore, yeah. And what was your name here?
Nancy.
Nancy, pleasure to meet you, Nancy. And you? Margaret, pleasure to meet you, Margaret. And you? Dewey?
Judy.
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 Judy, okay, all right, pleasure to meet you again, Judy. Okay, so now my talk today was supposed to be about arthritis. And as she just mentioned right here, we got all these joints in our body that can potentially have arthritis in them. Arthritis, there's several different types of arthritis. Most people know the two most popular ones, rheumatoid arthritis and osteoarthritis. Most people suffer from osteoarthritis, and that means arthritis of the bones and the joints. Rheumatoid arthritis is also dealing with mostly the joints. You get swelling around the joints and things of nature. That's where you see the hands that are all like this, or the joints that are big and swollen. That's rheumatoid arthritis. Osteoarthritis doesn't necessarily show up like that on the outside. You can't see that the fingers are all crimped, but if you took a picture, you took an x-ray, you can see how all the edges will be kind of rough and rugged. And if you picture in your mind a smooth street, and then you picture another street right next to it that has a bunch of potholes in it, that's how it looks. The ends of our bones and our joints are covered with hyaline cartilage, and that's smooth, like that smooth paved road. After it starts to get osteoarthritis from injury or with rapid repetitive movement or some type of things like that, it starts to get real bumpy, kind of like the street that has all the potholes in it. So that's kind of a vision for you. So whether it's in your shoulder, in your elbow, in your hands, in your fingertips, in your knees, in your neck, or your back, that's how it looks. It kind of looks like a bumpy road. Now, there's several things that we can now do to help repair that road, to replace some of the hyaline cartilage. Some of that stuff is electromagnetic stuff, laser stuff, like we talked about the ad right there. It's using wave therapy to help the body regenerate the hyaline cartilage right there. So it kind of goes in, and instead of just filling the potholes, it tears up the road and puts out a whole new road. Because you know how it happens if you just patch a road.
Yeah.
Eventually the potholes come back. So we're talking about some of that stuff. There's several medications that you can take for arthritis. And most of them are just painkillers, meaning that it blocks the pain signal and it doesn't make you better. It doesn't heal or fix the problem. It blocks the pain signal. Okay? So, with all that being said, who would like to be a volunteer for something? Who has a problem that we can work on here? What do you got?
I have neuropathy in my feet. And sometimes I find it really hard to walk.
Okay.
Which makes my knees lock up. So it's like, I always said if I'd have known when I was younger how bad my body would be now, I'd have taken better care of it.
Yeah.
But it's too late.
Well, it's never too late. We can't make you like you were when you were 20, but we can stop it from getting worse and stop it from progressing and reversing it. Hello there. What's your name?
Irene.
Irene, pleasure to meet you, Irene. Come on in and have a seat.
Okay.
What's your name, sir?
George.
George, pleasure to meet you, George. Come on in and have a seat. So are you saying you have knee issues today? Are they tender? Are they sore? Give me some descriptions here.
They just act like they're swelling. I can, once I get up and start walking, I'm okay. But when I sit down for any length of time, getting up, it's agony.
How long have you been sitting down right now?
Well, it's been 9:30.
So you've been sitting here almost an hour? Okay, come on. Okay, so that's a normal stand-up for you?
Yeah.
You felt that in the knees or the lower back, or both?
The knees.
The knees. Okay,
And
come on
the
over.
lower back.
Okay, come on over.
Well, I have bursitis in my left.
Macaroni and cheese.
Yeah.
Okay. All right. So we're going to do what we do in our office, which is a palpatory exam. How many people has ever been to a chiropractor? Have you been to a chiropractic physician? You have? Okay. So what do you remember from when you went there? Okay.
He's right over here by the
Oh, Dr. Brady. Or not Dr. Brady, Dr. Gilbert. There we go. Okay. So she has knee issues here. And we haven't taken any pictures. And so, but you probably have some osteoarthritis in here. Okay? So do I have your permission to move the joints around everything? Okay. All right. So one of the things we would do is a palpatory exam. The reason that we do this is we want to identify the tissue that is most tender, okay? So now just relax here. Let me know any tender spots around here. Anything tender as I do this?
A little bit sore, but nothing outrageous.
Okay, all of those are pretty good.
Yeah.
Is one knee worse than the other?
This one.
This is the worst
This one
knee?
I had surgery on.
What happened to
Had
it?
cartilage removed. I tore my cartilage.
Okay, any metal in there?
No.
No? Okay. So, that's a spot right there. Okay, how's right here? And then right here. So we got 1, 2. How's right here? Oop. 3.
Whoa.
And then 4. Okay, so we got 4 spots here. Now your kneecaps will be able to move in 8 different directions. I just moved hers around, and we got 4 spots here out of 8. So 50% of the motions that her kneecaps should go in are painful. Okay? So that's sending signals from her knee to her brain telling her not to make that movement. So we want to make sure that you actually can make that movement if you want to. So I'm going to have you go ahead and stand up for me again. Okay. And then go ahead and sit down for me. Now standing up again, you felt a lot of that right there. All right, so I'm going to use one of the tools that we use in our office. And this here just works on the soft tissue and the ligaments around the joint, okay? Now, it sounds kind of loud. This is what it looks like. Sounds like a drill or a saw, but I'm not cutting anything off and I'm not making any holes. Okay? Let me see your hand. This is what it feels like. Okay? Okay, so that's what it feels like. Now, I'm going to work around in these 4 spots where she had that tenderness at, and we're going to have her stand up again. And before we do that, let me have you stand up again one more time. Okay, then go ahead and sit down again. Now, when you stood up on a scale of 1 to 10, what did that knee feel like? If 10 is the worst ever and 0 is nothing, where was that at?
About a 5 or 6.
5 or 6? What was this one here?
Normal.
Normal. What's normal for you?
About a 2.
About a 2. Okay. So 5 or 6 gets her attention. Normal over here is about a 2. Okay. So I'm just going to sit it on here and we're going to move it around with all the ligaments that attach to this kneecap. Right now I'm working the patella tendon. The patella tendon is the tendon that attaches right at the top of your kneecap. There's one underneath it, and you got one on the medial side and the lateral side. See, and some of you thought that getting adjusted would hurt. And she's over here giggling and laughing, so good. Can you tell them how this feels here?
Feels great. It was feeling so funny.
So now, you see me going back and forth with this. I'm going cross-fiber friction to the direction of the muscle. It helps stimulate the blood flow that goes to the muscle, helps push out the toxins that's in the muscle, and it helps send a message from the muscle back to the brain saying, hey, I'm stronger, I can tighten up, I can do something.
Sounds like a neighbor.
It does, and that's why I said we got stuff that sounds like drills and saws, but we're not doing any holes or anything like that. Now, is that the tender spot right here?
Right here.
Right there? Yeah. Now, is that painful or does that just feel funny?
It's kind of like a sock.
Start to it? Okay.
Now that hurts? It hurts.
Oh. That's just the thing.
No pain, no gain.
Here we go. Okay, so now, what was that, 2 minutes?
Yeah.
Okay, so we got it right on top of her tender spot. Just moving that knee like that, how's that knee feel?
Oh, wow. Feels great.
Hurts to
Okay.
feel good, huh?
Okay, so now let's go ahead and stand up. How was that?
Oh, great.
Okay.
Now this one feels bad.
That was so this one's jokes. So now this is jokes. Okay. Go ahead and have a seat again. Now, when you stood up that time, before it was a 5, 6, what was it just now when you did it?
A 1?
A 1? A 1 or a 2? Okay, so now that's just as good as her good knee here now. So now we can improve on what we just did right here. So while I'm gonna leave this knee with one of my other tools here, and then I'm gonna work on this knee right here, okay? So she might be dancing on you tonight. So I'm gonna use this tool right here.
Oh boy.
This is called a magnosphere.
I thought that was a panel.
It looks like one. So you get out of line.
You're gonna shock my heart.
So actually, I'm gonna sit it right here on her knee. Now she's not gonna feel anything from this, but what does, this has cellular exercise. You know how you go to the gym, you work out? Yeah. Where our cells also need exercise. So when we exercise our cells, they get stronger too. And then again, we're able to go ahead and increase range of motion, increase the strength, and decrease pain. And this is all done naturally and is long lasting. This isn't temporary. So it goes right through clothes, so I don't have to have it on her skin at all. So I'm just wrap it on here like this.
There, Rita. It's not going to leave.
There, and then I'm just going to cut this on right there. And you can watch it here. You see how those green dots go up? And then when it turns red right there, that means that it shot a pulse in there. Okay? So I'm going to sit it right there. And that was like one of your worst spots. So now, while this is going, this usually would be 10 minutes right here. We do this for 10, maybe 15 minutes, depending on the level of severity that a person has. So now, while that's taking place here, I'm going to assess this knee, and then we're going to use this tool here. And then in 4 minutes, we're going to have her stand up. Okay?
I don't even feel anything.
Yeah, and that's the whole thing. This is actually sending a wave into her knee about 9 inches like this. So theoretically, you could put two knees together, treat over here, but you'd be treating half of this knee. Put another one here, and now you're treating over to half that knee. So you get treatment just like that. Or, for example, you have your informational letter right there that talks about shoulder pain. I have patients that come in the office, they sit there with it on the shoulder pain, and you see on the back, they're doing this, and then they do this here, 10, 15 minutes, they're doing this. You know, we do that 12, 24 times, now they can continue to do that, they don't have to come back and see me. Usually they come back and see me with something else. So, let's look at this knee here now. So there was nothing really tender on this side.
No.
Okay. So then, let's do this. When you stood up, you said it was the knee, and then it was the lower back on this side. Is it a spot on the lower back you can touch like that? Or is it like in here?
No, you can touch.
You can touch it. Where would it be at?
Like, right.
Okay, so back there. Okay, so that's the hamstring, the popliteus. Okay, all right. So then we can get that here in a moment. Okay, so I got my knee assessment right here. There was nothing that really made her jump off the chair right here. But I'm going to go ahead and work the main ligaments just like I did over here. How's that feel? That ticklish?
Funny knee, funny knee. Rita's got a funny knee. Now, in your office, if I were to come in for a treatment, do you do it yourself or do you have educated girls that help you?
Some of it I do myself, like this right here, what I'm doing here, I would do myself. And I do have educated people in the office to help. When you come to our office, first of all, it actually starts when you're on the phone. You call the office and the person that answers the phone actually acts like they want to talk to you. So they're not rude on the phone. They give you all the information that you need. Oftentimes, we're booked, so it might take 2 or 3 days to get in. So we mail you out information so you can fill out your paperwork at home. It's like an application, you fill it out at home. And then we actually give you directions from your door to our door. So you know exactly how to get there. We give you our hours, we have plenty of parking. Once you come into the office, our ladies are going to come around the front desk, give you a double handshake, and greet you like you're coming to our house. They're going to sit down and help you with your information. So if you have something that you couldn't fill out or you had questions about, they're going to sit down next to you like your personal assistant and then help you. After all that's done, you know, they'll get you a beverage, some water, something along those lines like that. We take you into a private treatment room. We get your vitals, you know, all the vital stuff, your blood pressure, your heart rate, all that stuff like that, temperature. We record all this information because it's very vital to your health records. Once all that's been done, then I come in. We do a one-on-one consultation. And that way we sit back and you tell me about your medical history. You answer any questions that I have. I answer questions that you have. If we agree that this is something that we can help in that office, we do a physical exam. With the physical exam, we do an orthopedic test, a muscle test, a neurological test, a range of motion test. We do all these different tests just so we can identify the tissue again, like I talked about, the primary source, the real cause. Once we've done that, sometimes we'll do x-rays if we need to. Sometimes we don't have to. After we've done those images, we do testing like this because we do this stuff here in the office on the first day to determine if some of the stuff that we do in the office can actually help. You come back the next day and you give us feedback. Like today, I already know you're going to feel better. Tomorrow, we want to see how long that lasts.
Yeah.
And if it lasts an hour, if it lasts 24 hours, if it only lasts 5 minutes, that gives us feedback. So now we know how much you would need in order to make it a lasting, beneficial thing. That's something that you wouldn't have to worry about. You know? So that's how that works in our office. So yes, I have helpers, but I interact with all the patients as well. Okay? So I'm going to finish up this knee here, and then I'm going to get back behind that leg. And then when I stand up,
Now, do you treat people different that are diabetic?
yes. Now, when a person has diabetes, that's what we would call a comorbidity, meaning that diabetes is a complication, just like heart disease is a complication, just like osteoporosis is a complication. If one person had all of those things, now they have comorbidities. Those things work to decrease your level of immunity because your immune system is fighting off the diabetes, it's fighting off the osteoporosis, it's fighting off the arthritis, it's fighting off these different things. So we take people on a case-by-case basis, and then that way you have to have very specific biomeasures. That's why we do all the testing. You have to have very specific symptomatology, and that's why we had a conversation to get your detailed history. Then you got to have the right test. So once we get all the information and we collect it, we can individually make a plan. It's not like one person gets the same thing, you know, or that everybody else gets. Everything is individual, specific, and designed individually for you. So now I'm going to do the back of this leg here. Right there?
Yeah. Now that feels good. Wow. What a difference.
Okay, I'm going to stop this here. Okay, so that's stopped. Okay, go ahead and stand up for me. How was that?
Wow, I can stand up like I'm a normal person.
Did you guys see the difference between her first stand up and sit down compared to what you just did right there? So,
Wow.
So now on a scale of 1 to 10, what does that mean now? You were started out with a 5, 6.
Not even a 1.
Not even a 1. How does this knee now feel?
It's still a little bit sore than this.
Okay.
But
And that's
it feels great though.
okay.
Yeah.
Okay. So there we go.
Not
So-
with neuropathy in my feet, I can't.
Now, even with neuropathy, and I didn't bring it, but we have a tool in our office, a lower body vibration platform. It sends signals from your feet back to your brain and then back down to the feet. Now, those signals always are happening. So when we can't feel our feet, when we lose our balance, we're sending a negative signal to our brain. So that's how that happens. With the vibration platform, it sends the right signals to the brain. It's like sending a whole bunch of signals real fast to the brain. So it's like, again, working out the nervous system from the feet back to the brain. If I see you guys again, I will do that. How's your feet feel today? How are you right now?
Mostly they're pretty numb, but it's like when you come outside and your hands are frozen.
That's how they feel.
Right now they feel like they're waking up.
Yeah.
They still got the tinglies, but most of the time it's just solid, you know?
Yeah. Oh, it feels like a block.
Yeah.
Okay. Well, that's something again that we help in our office. Let me take this here off. All right. Does anyone else have anything they want me to check out right quick?
Well, I know my ex-sister-in-law was having trouble with her back,
Yeah.
and she went to a chiropractor. And he did do x-rays and everything. And without her telling him what's happened to her, he told her, well, you've been in a car accident, you fell, you this. And she was amazed. He could tell her everything.
Yeah.
She swears by a chiropractor.
Yeah, well, our bodies are like books, and they tell us stories. So our goals are to read the book and then identify it. All right. So anybody else here?
She has a curvature. What do you do with the curvature?
Well, so you're talking about scoliosis?
I guess, I know it. Like a S. Good shot, Sherlock.
That's too.
That's my doctor. So it depends on how big the curvature is. Because if you're a 10-degree curve, that's a functional scoliosis, and you know, you can monitor the change in it. If it's a big drastic curve, it's like 50, 60, 70 degrees. Now you're talking about a person.
Yeah, well, I'm not like that, but you know, I always have a back. It's always across here.
Straight line across like that.
Well, no, sometimes it's right here, sometimes it's over there.
Where's that?
Right here,
Right here today?
yeah.
All right, let me have you come over here for me. Okay, let me have you stand and face that way. All right, so right there,
No. Did I tell you over there, right here?
right here in the middle.
Yeah.
Okay. All right. so-
Today.
Today, okay.
Yeah.
So what we're gonna do here, we're gonna do range of motion. We wanna test our range of motion. So I'm gonna see if you can lean this way, go as far as you can. Okay, then come back up. Now you bent the knee a little bit there to get a little extra range of motion. As you bent the knee, that takes some of the pressure off the lower back there.
Yeah.
Okay, let me have you go this way. How's that way right there?
That's okay.
Okay. And then I'm gonna have you turn to look at me, just with your waist, just at the waist. As best you can, as best you can. I'm sorry. Keep your waist just like this, and then turn and look at me with your upper body. There we go. Okay. And then you look the other way. Okay, so that's the most that you can turn to see me?
Yeah.
Okay. All right. Now, if you had to touch your toes, could you touch them?
I don't know.
Okay, I don't want you to. I'm just asking if you could.
I don't know.
Okay. And then I'm going to bring you back a little bit like this. How's that?
Uh-huh.
Okay, you felt it more increase right there?
No.
Okay. All right. So go back up straight. All right, so do I have permission to work on you right there?
Yeah.
Okay. All right, let me see your hand. This feels like this.
Oh.
Okay, that's how that feels, okay? All right. So I'm going to work right in that spot. So while I'm doing it, I'm going to have you just do this. You're just going to do like that, okay?
All the time?
The whole time. Okay? Is that okay for you?
Yeah.
Okay.